Hi. Each of us can remember a moment, an event, or a time in our life when we realized the fragility of health. The first question I ask many of my guests, when did you realize health was fragile, breaks the ice. It tells a brief story, and it shifts the brain from nervousness of a recorded conversation to something personal. I recently attended Healthy Voices conference sponsored by Johnson & Johnson Pharma. Janssen invited about 95 patient advocates for 3 days to network, learn, and party. What an opportunity. I brought my recording equipment and asked questions. I asked, when did you first realize health was fragile? How do you recognize success in your advocacy? When you meet a newbie advocate, where do you point them for skills, resources, and research? I spoke with 26 of the participants for about 5 minutes each, resulting in over 2 hours of recording. I can't include all 4 topics in one episode, so in this episode, I'll share when people first realized health was fragile. I'll cover the others in subsequent episodes. For this episode, listening to the podcast audio will suffice, but seeing a snapshot of the speakers' beautiful faces might be nice. So read the transcript or watch the video on my YouTube channel. Welcome to Health Hats, the podcast. I'm Danny Van Leeuwen, a two-legged cisgender old white man of privilege who knows a little bit about a lot of healthcare and a lot about very little. We will listen and learn about what it takes to adjust to life's realities in the awesome circus of healthcare. Let's make some sense of all of this.
My name is Estela Mata.
When did you first realize health was fragile?
Wow. We take health for granted. And when you know that your life can be taken away, your health conditions can make an impact, I think is when you realize it.
My name is Sharnae Naismith.
When did you first realize that health was fragile?
Oh my gosh. I'm going to tell you, it was like right when I got diagnosed with lupus because I was living my best life. I was happy, I was young, I was free, didn't have any worries, no stress, nothing. And then to get that diagnosis that I had lupus, that's when my whole life changed. Yeah. 1 minute I'm going on trips, living my best life with all my friends and working a job. And now it's just, oh, okay, so now I have to tend to me. Yeah. When you get diagnosed, it has to be more about you. I realized then, like, health is just fragile. I was taking advantage of it every single day. And so now I realize how important it was. I should have been taking care of me from the beginning.
Jim Snedden. In 2005, I was handed a few too many issues. I got laid off from work. My daughter was raped. And I wound up getting psoriasis from that.
Christine von Reisfeld. Oh, I think I have known that health was fragile my entire life. I will tell you, I have talked to people and I tell people that I don't remember a day in my life that I've ever had without pain or without ever some kind of issue. I would say my earliest memories were always pain, and I experienced them even at like 3, 4, 5 years old. My first surgery was at 5. I do tell people that being sick early in life and having this has really given me a different sense of what life is. I live in Silicon Valley where most people are focused on money and all of that. I don't have that viewpoint. Money is nice, but I think really just having happiness and just knowing that you're okay. I meet a lot of people with money who are not happy, and even with my illnesses, I have a pretty amazing life.
Helena Johnson.
Hi.
Hello. I realized health was fragile when my health was threatened.
Oh, okay.
When my health was threatened, when being young, you think that you can live forever and that everything is happening around you is nothing compared to you being you and I wasn't jumping cars and things like that, but I was skateboarding, riding that bike. Grew up around brothers and just living life like a thrill. Then all of a sudden you get hit with a chronic illness and it's, whoa, stop. You cannot do the same thing that you were doing. That's when I realized that my health was sensitive and that my life was fragile.
My name is Jason Crum, C-R-U-M.
Hi, Jason.
I first realized my health was fragile during the pandemic. I was hospitalized and put into the nursing home because I had developed a polyperipheral neuropathy, I also have HIV as well as M monoclonal gammopathy of undetermined significance, which is a precursor to multiple myeloma, and I have chronic hepatitis B. So I'm fragile.
My name is Jason Jepson.
When did you first realize that health was fragile?
I have schizophrenia, and it was back when I was early in recovery, and I was a danger to myself and my parents, and they had to call the police on me. I wasn't arrested or anything like that, but they took me into custody. I was handcuffed in the driveway. This is the bottom, but I knew I was going to finally get help and figure out what's going on inside my mind.
Thank you. Tell me your name.
Brooke Abbott.
Brooke Abbott. Oh man, Brooke, it is so good to actually see you.
I know.
What was it? WeGo.
Yes.
Is that where we met?
Yeah.
When did you first realize that health was fragile?
I probably was pretty little. I've had asthma my whole life. I mostly advocate for inflammatory bowel disease, but I have been an asthma patient. I think I was diagnosed at 1.5, but I grew up during the AIDS epidemic. I had a lot of people in my life who were severely impacted by how it was mismanaged. And I understood very early how quickly your health can turn around. Knowing someone who was very healthy 1 week and then unfortunately not alive in the next few weeks.
My name is Felissa DeRose. I realized health was fragile really when I was diagnosed with diabetes, but I was misdiagnosed.
Oh.
For 8 years.
Oh.
Yeah. So I would say I was 30 when I realized health was fragile.
My name is Bethany Yiser.
Hi, Bethany.
I think that I first realized that health was fragile when I was diagnosed with schizophrenia. I remember learning that it was a brain disorder that could affect anyone. And I learned that 1% of the population in every country, every race, every socioeconomic status, 1% of all of these people developed schizophrenia. It was no respecter of persons.
My name is Ken Taylor.
Hi, Ken.
I'm a caregiver, so I don't have a diagnosis, and so it took me a little while, but my wife, who I give care to, and she saw 43 doctors before she got a proper diagnosis. That's what really got me to realize how fragile things are. But that's what really triggered it for me, is watching her go through it. Naturally, when somebody has a catastrophic event take place, they don't have all the answers. Who does? So you put most or all of your trust into the doctors and hope for the best. They're the experts. And we did that, and it took us down a few paths that we never would have chosen for ourselves had we known the outcome.
Now a word about our sponsor, Abridge. Record your healthcare conversations with doctors and other clinicians with Abridge. Push the big pink button and record. Read the transcripts or listen to clips when you get home. Check out the app at abridge.com, ABRIDGE.com, or download it on the Apple App Store or Google Play Store. Let me know how it went.
My name is Cindy Shimoleski. When did I first realize that health was fragile? I think I was fortunate that most of my life I was healthy My family was healthy. My children were healthy. So I don't think until I myself was diagnosed with a cancer did I realize health was so fragile. I had friends who were going through hard times, but it wasn't really happening to me. So I felt bad for them. I don't know if that's good or bad, but I felt for them. But since it wasn't affecting my life, I just moved on, not realizing how health can impact your life for a long, long time.
My name is Jesus Guillen.
So, when did you first realize that health was fragile?
Such a simple, complicated question. First, I guess I was never the macho type, full of testosterone guy first. So in some way, I was always fragile. But the reality is that then, like I mentioned before, my life has never a 9-to-5 life, and things happen to me for good or for bad. And sadly, and I'm not one of those guys that can tell you I'm so glad I had my disease and that's what I'm here. I'm sorry, I just cannot say that. So being very honest, my health is getting, I think the moment that I started to feel really fragile the most, it was when I had cancer. And I was so fragile that I felt my worst because the nurse was even cleaning my shit, like they say, and I couldn't hardly move. I remember I was in bed one time, and because I was not able to move for a long time, my back started to hurt a lot. And I called the nurse and I pressed the button. I said, something is really wrong. I'm in incredible, horrible pain. And the nurse came over, and all what he did was he just moved me to the side. Because it was just because I've been not moving for a while. That's what I was hurting so much. But I want to get really fast. Also, that's when I started to become more fragile because I suffer of anxiety and PTSD. And every time before going to bed, when the anxiety goes too high, that's when I feel the most fragile.
My name is Christopher Quimbar. I don't have any major health issues, but I have had family members, loved ones who were still here and some who are not here, who've dealt with major health issues. I've been a caretaker, so to speak, and I've had a partner pass away from mental health issues. I've had another partner who recently passed of HIV. And then my sister right now my father also passed of cancer. So it's certainly been in my life for as long as I can remember.
My name is Stephanie Trong. I first realized health was fragile when I was suddenly diagnosed at 31 with cancer. And at the time, and I hear this, I interview a lot of patients myself, and at the time, I was a journalist, a TV news reporter, and explained away all of what were the first symptoms. Fatigue, I'm exhausted because of my job, bloated because I'm a woman, and it wasn't until there was a very foreign cough that was the catalyst to actually get me into the doctor same day. And from there, 24 hours later, I got the call that I had cancer.
My name is Michelle Nadine Baker. The day I was diagnosed, which I'll never forget, like many cancer patients. And it was back in 2012. So I have blood cancer, leukemia, called chronic lymphocytic leukemia.
My name is Jenna Green. I first realized that health was fragile when I was in my late 20s and I was sideswiped by an ambulance in a car accident. They were going to Dunkin' Donuts and they didn't see my little silver car. I'm not a bad driver. I just like to put that out there. They were not on alert. So that started some chronic back pain issues for me as a very lucky to be privileged growing up rather healthy and active.
I'm Kara Beck.
So, when did you realize health was fragile?
I feel like I had a general sense of it for a long time. I grew up struggling with my weight. I grew up fighting that and was a test bunny in the medical field, got a bunch of tests, and I continued to struggle with it up until my adulthood and into my first pregnancy. And that's, I think, where I really realized that health was fragile, because I had been facing the health issues my entire life, but I was in the hospital frequently with my pregnancy, and there were some times where my son's life was at stake because my health was not good. I had high blood pressure. I was induced 2 weeks early, and both of us were struggling just because my health at the time was not where it should have been for a proper pregnancy. And it was that moment of fear for not just my life, but for his, because I was like, I knew from growing up that I was not okay, but seeing it in a different perspective, it really woke me up.
Jasmine, that's a really good question. Honestly, I feel like when I was 20 years old, because that was the first time I was diagnosed with depression, and I learned how broken the mental health system is, and that really just woke up my eyes, because until that point, I figured like the healthcare system had everything covered, like they knew what they were doing with everything, but it's like with mental health, there's even things like healthcare professionals still don't understand. It's very misrepresented just field, and it felt horrible being diagnosed at that time because I didn't really have a lot of resources or things to go off of. So it's like I had to research and find out, how am I going to navigate all of this?
My name is Sue Rarica.
When did you first realize that health was fragile?
Oh, probably really young. My grandfather had a lot of health issues. Even though he was a few states away, I would hear stories from my mom. He had diabetes as well, and he also had cancer and some other conditions.
My name is Alexis. What comes to mind for me is when I was diagnosed when I was 18 months old with type 1 diabetes. So I don't necessarily know if I ever thought life was fragile, but I always knew that I just had to do extra things in order to stay well and be well. So like I had memories of like when my blood sugar would be very low and my parents running into the room, shoving icing down my throat to help with my blood sugars to help them come up. So I just have those memories, but I don't know if I ever resonated about being fragile.
My name is Ryan Williams. I first realized health was fragile when my grandmother seemingly went from 0 to 100 with Alzheimer's disease. She went so bad so fast where it's just, wow, health, like you could get sick that fast, and that really stuck.
My name is Sam Seavey. Probably my mother passed away when I was 15, passed away from breast cancer. And that was 1991. So I think that was my first experience with that kind of thing. Yeah.
Andrew Shore, Schorr. In 1996, I was getting routine blood tests, and later that day I found out I was diagnosed with leukemia. I was 45, and I thought that was the end, that I was dead. So I felt pretty fragile.
My name is Howard Chang. I was diagnosed with psoriasis as a child. I lived with my grandparents who came over from Taiwan because they were sick. So I think very early on, my grandpa had 2 strokes and a heart attack. He was in a wheelchair. So I think I had a sense of the fragility of health through him. And then when I was diagnosed and had to start dealing with all these, everything that comes with a chronic illness, I never could take my health for granted after that.
Wow. Thanks for sharing. Some people reflected on hearing a diagnosis or misdiagnosis. Others reflected an abrupt change in function through illness or accident or the death of a loved one. Some feel sad and disappointed, others hopeful and empowered. All crossed a threshold, a before and an after. All told a story. What's yours? Who do you tell? I host, write, edit, engineer, and produce Health Hats, the podcast. Kayla Nelson provides website and social media consultation and creates video trailers. Joey Van Leeuwen supplies musical support, especially for the podcast intro and outro. I play Barry sax on some episodes, alone, or with the Lechuga Fresca Latin Band. I'm grateful to you, who have the most critical roles as listeners, readers, and watchers. See the show notes, previous podcasts, and other resources through my website, www.health-hats.com, and my YouTube channel, @DVanLeu, DVANLEEU. Please subscribe and contribute. If you like it, share it. See you around the block.